Well, hello, everybody. My name is Melissa Mazor, and I am a nurse scientist in the Community Outreach and Engagement Program at the Tisch Cancer Institute. And I am so delighted to be with all of you today. So to start, if we can go around and please introduce yourself and provide just a very brief background about yourself and your role in cancer care.
Hello, everyone. My name is Rolfo. I'm a professor in medicine at the Sinai Icahn School of Medicine at Mount Sinai, and I'm the Associate Director for Clinical Research at the Center of Thoracic Oncology. My focus of interest is cancer care for thoracic oncology patients, and also specifically, I'm working in drug development and biomarkers in liquid biopsy.
Hi, I'm Dolores Moorehead, and I work for the Women's Cancer Resource Center, where I am a Community Engagement Director and Client Support Clinician. And what that includes is I provide patient navigation to our clients that we serve. I also provide therapy to them and lead support groups and work with different researchers around the needs of diverse populations.
Hello, everybody. I'm Lavern McDonald, and I'm a community scientist for the Icahn School Mount Sinai Project. I'm also a social studies teacher at a small independent school in Manhattan, and I was diagnosed with lung cancer in 2018.
Well, what comes to mind for me is a quote that I heard a woman say when I was at another function, and she was talking about participating in a clinical trial. And she said, if you are not at the table, then you're on the menu. And it's resonated for me so much since he said that I think about we bring people to the table. It's like the citizen scientist, that opportunity. Is that opportunity being offered as widely as it could to communities of color? And if you bring them to the table, they get to learn, they get to spread that information, and they feel a part. And they also get to sit with doctors and researchers, and that doesn't become something, it loses the feeling of that's foreign and that's not something I can do. That's not for me, that's for others. It becomes ingrained and gets to be passed down, as you were talking about educating the children. It allows them to have a different thought process. That's not over there. That's not something I don't do. That's not something I can do as a person of color, as a LGBTQIA individual. It allows them to say, this little seed's been dropped. So you know what? I can do this. I think that to me is how we began to build a foundation that looks different, and change happens that way. So that we are hopefully, by the time I'll give myself, by the time I'm 80, since I'm in my 60s, by the time I'm 80, that I won't be still hearing. We won't still be talking about this, because I feel like I've been hearing this since 1989 when Dr. Harold Freeman talked about it, about cancer and the poor. That if we change this in my lifetime, I'll get to hear the kids that are coming up doing something different, and we won't have to be having this discussion.